Welcome back to IPHA's Interprofessional Health Talk, an interview series focused on showcasing interprofessionalism through insightful discussions with various professionals and students within the healthcare sector. And we're hoping to expose students to different career paths and skill sets so that they can make more informed decisions about their future. And I'm Dina.
And I'm Jenna, and I'm very excited to introduce today's guest. She is an experienced registered nurse pursuing further training to be a nurse practitioner. Welcome, Melody. It's so great to have you here.
Thank you, both of you, for having me here.
Of course. We're really excited to hear what you have to say and learn more about your journey. To start, could you walk us through why you chose to become a registered nurse?
Absolutely. I think the typical answer to this question is I want to help people. But choosing any career, especially in healthcare, requires a bit more profound thought. There are so many roles and players in the realm of healthcare, and I think it's important to reflect on one's own talents and capacities in order to determine if a certain field is right for somebody. As you're well aware, the healthcare system is almost like a profound web of important players. And the system would not be able to function without each of these pieces working together with excellence.
You've also worked as a personal support worker while you studied. Did you feel like that kind of gave you an advantage for knowing what to pursue or continuing in nursing, or whether you wanted to shift to anything else?
I really like this question. This is a great question because I'm currently working as a research coordinator at the Ontario Centre for Learning, Research and Innovation in Long-Term Care, exploring how we can help enhance nursing student experiences in long-term care. And that being said, to answer your question, I did work as a PSW in a long-term care home in my second and third year of nursing school. I think in a sense, this opportunity did provide me with a familiarity with patients and witnessing both chronic and acute medical concerns from diabetes to dementia. I think the more you can see in real life and the more you can serve patients in contributing to their emotional and physical well-being, the better.
When we met before, like a preliminary meeting, you touched on a really unique experience as a research assistant with the Correctional Services of Canada. Would you be able to talk more about that?
Yeah, for sure. So during my master's, usually when you do a Master of Public Health, there's a practicum component, which is really nice. And for anyone that wants to know, it's not all research. You do get to have your foot in practice a little bit as well. So during my master's, I did my practicum at Aboriginal Initiatives Directorate at Correctional Service Canada as a research assistant. And I moved on to get a job at Correctional Service Canada. It's the federal government as a regional coordinator for health promotion, where I would essentially drive around in a government car and visit different federal prisons across Ontario. I would help gather statistics or statistical data on opioid overdoses in prison and implement a program called the Peer Education Program, where I would essentially train a group of individuals incarcerated in health practices related to recognizing and preventing opioid overdoses. So basically, I'm not an experienced nurse practitioner. I just finished my first year of my NP diploma with the University of Ottawa. And essentially we had, different practicum experiences. And I was really fortunate to be a part of a health team. So a lot of people don't know what a nurse practitioner is, or they don't know what they do. And this gave me a really good insight and idea. And I would say essentially a nurse practitioner can do almost everything a family doctor can do, like a doctor's office that you would go to. So, you go to work, you go to your clinic room, you turn on your computer and you just see who your first patient is for the day. You can research a little bit about who they are and their background and what they're coming in to visit for, and do a little bit of preparation so you're ready to see them. This is what I would do as a student as well. So, I thought it'd be interesting to kind of go through a case, like what we see. So this is like something we would typically see in a primary healthcare center. So Madeline is a 28-year-old female, and she was recently diagnosed with depression. She comes into the clinic complaining of weight gain and fatigue. She appears sad with a flat affect. She's been started on an antidepressant that has increased her appetite, and she admits to eating more than usual lately. Her sleep has been disturbed by her thoughts, which may be contributing to her fatigue. So, these are the case studies and questions that a nurse practitioner should go through. Then from there, the second question is, what components of the physical examination would be important? So after your thorough health history, after really speaking to your patient and understanding, what they've gone through in their life, what they have a history of, what medications they're on, we have to do a physical examination to better investigate what this problem is. So in this case, we would do her vital signs. We'd start by, checking her vital signs, which are most important because that might indicate that a patient needs to go and be hospitalized. In hypothyroidism, you might see a mild hypertension. You would observe her head and face for coarse or thin hair, thinning of the eyebrows, facial puffiness, brittle nails. These are some things you'll see in hypothyroidism. Observe her speech, see if it's slow, see if she assess the heart. So you would, listen to the heart for any bradycardia. You do a lung assessment. She might be breathing more slowly. You would do an abdominal assessment, check for any constipation. You would do a neurological exam. She may be hypotonic or hyporeflexic, like her reflexes are a little slower. You would, look at the different systems. So another would be her genitourinary system, ask about her menstrual periods. You would check for any edema in her arms and legs, and just look at her overall appearance. And this is probably one of the most important parts, is to palpate the thyroid. Any pain in the neck, see if there's a goiter in the neck. Because if someone is having thyroid problems, there's a likelihood that their thyroid gland is enlarged. You're going to check for symmetry, and you're going to see if it's firm, if they're having problems swallowing, and if you find any abnormalities in how the thyroid feels or looks to the patients as well, you're going to send them for an ultrasound. So I know that was a lot of information, but I wanted to give a really clear picture about what a nurse practitioner has to kind of think about and assess. You really have to assess all of the systems, do a really thorough physical exam from the head to the toe in order to figure out what this health problem is. So the third question is, what lab investigations should be ordered, and what results would you expect with hypothyroidism? So there are many other tests that one could run to rule out health concerns like anemia. You would check hemoglobin and other laboratory tests for anemia. But specifically to hypothyroidism, I would test for thyroid stimulating hormone. It's a blood test that measures this hormone, and thyroxine, also known as T4. So essentially in primary hypothyroidism, where it's like actually a problem with your thyroid gland, you'll have elevated TSH. The stimulating hormone will be really, really high. It's trying to stimulate your thyroid. And you'd have decreased serum T4, which is your actual thyroid hormone, thyroxine. So, and you would follow up with your patient depending on the status of their health. That's also a key thing I learned in nurse practitioner school is it's really important to follow up with your patient in primary healthcare. You can't just try to treat them and just leave them on their way. It's so important to follow up. You haven't actually treated it correctly. This could be to the patient. So question number 4 is the physician in the assessment or treatment of this client. So, you know, I wanted to emphasize that this answer to this is no. Nurse practitioners can work on their own and don't need to be supervised by a physician to practice. Nurse practitioners have an autonomous scope of practice, but typically work in collaboration with physicians and other healthcare professionals. For example, I might refer this young lady to an endocrinologist if necessary, if the patient has any history of cardiac disease. And in the context of a team, you know, I might even refer her to a dietitian to manage her weight concerns. So we do work in a team. In some, you know, in a lot of cases, we don't need to be supervised, or we don't need to be supervised by a physician, but we certainly collaborate a lot with many of these team members.
I have a little question.
Yeah.
How long is nurse practitioner school?
So it is 2 years full time with if you do not have a master's degree yet, so you'd have to do a master's in nursing full time, and then another year of your clinical practice. And then you essentially have like a mini residency, or it's called an integrated practicum.
So could you talk about the difference between a registered nurse and a nurse practitioner?
So I think I spoke about the scope of a registered nurse earlier when we started this chat. So, you know, nurses really are a backbone of the healthcare system, and they play a huge role in assessing patients, making sure their patients are safe, you know, responding to crises sometimes before physicians are aware or even able to get there. So being an RN not only requires the ability to carry out certain practical skills, but also to think critically, putting research into practice using knowledge-based practice, because medical information keeps changing and nurses are sometimes the first to respond. So you have to be fast.
Do you have any tips for retaining information? Or like, what have you learned that's helped you retain?
This is a good question. I've actually done a little bit of research on this. They say small doses on the daily is better than a lot at the last minute. So just reviewing content for a short period of time every single day is more effective, and you'll actually retain it longer. Yeah. So if you have like, I got this app. I'm not here doing a promo, but I got this app called Quizlet, and it syncs with my phone and my laptop. So I'm sure maybe you know about it already.
Quizlet is godsend.
Amazing. Quizlet is amazing. Sponsor
exactly.
us, please.
Sponsored. This is not sponsored. But I find it helpful to like write my notes and then look at it. But yeah.
Yeah, that's really good. It's nice and concise and easy to follow and understand. Yeah, thank you. And with that, I think we're done with all of our questions. Would you like to add anything else?
I think what you're doing as a club is fantastic. You all are working so hard to bring awareness about different facets of the healthcare system to light, and keep doing what you're doing. It's amazing.
Thank you. Yeah, we try. Aw.
We really try.
Thank you so much. And thank you so much for being here and for giving us some time out of your day in such a good conversation. And we've learned so much from you and just gaining so much insight into what a nurse practitioner does. Like, we've been asking that for a month, and we're so glad that you're here to just give exposure to everyone about what it is and all the different practices and the scope of care that a nurse practitioner has. And thank you to everyone tuning in to another episode of Interprofessional Health Talks. We hope that you've enjoyed this episode as much as we did. And as always, you can follow us on our social media platforms at UOttawa IPHA, and have a wonderful week. Thank you so much.